Okay, so we're looking at a plantar second metatarsal head lesion here. So these are really common, particularly in a foot that pronates in the first ray or that first metatarsal dorsiflexors. The reason why it does that is the first metatarsal is free to move up and down, so dorsine plantarflex, and the second metatarsal is actually locked in place by the mortise of the proximal end of the metatarsal, so it's actually fixed in a downward position. So when our feet roll in, if you've got this flexible first ray, it puts a lot of the pressure under the second metatarsal head here. So what usually happens is this builds up like a thickened callus over the metatarsal head, particularly as we age, and the fatty pad also wears out with use under that metatarsal head. And then you get this callus formation, and it can ulcerate and cause corns. So what we're doing here is just going in, removing all this callus. This is completely painless for the patient as well. We're using a number 10 blade because generally what we do is we try and match the blade up with the area or the shape of the corn we're trying to remove. Now this one's just a sort of more diffuse area of callus, and it's got this little bit of a central section, but we'll just basically cut that out with the edge of the blade, not the tip. And we remove it all. So what we're trying to do is just prevent further tissue breakdown here. So this is of course just what we do to treat the local symptoms. We use a arch support orthotic with a metatarsal dome to try and deflect pressure off that. A good shoe, a good work boot, make sure it's fitted right, and it's got cushioning in the forefoot so it's not too soft, not too firm. So remember, if we go too soft, it'll encourage the foot to roll in, which will make this worse, and if we go too firm, it'll cause more pressure, which will make this worse. So we need to be that sort of Goldilocks situation where it's just right, not too hard, not too soft, and enough support in the arch to take the pressure away. And hopefully we'll get either the treatment time extended between these, or we'll help resolve this one, and then we'll be able to review this one in about 8 weeks.